everybody, and welcome to the Health, Wealth, and
Relationships with Tisa
and Grant.
Good morning.
Good morning. Good morning. Good morning. It's
Good
Thursday morning, right?
The 26th of February.
The last Thursday
of February.
That's right.
Did the month go fast, y'all? You know, we only get 28 days. So,
you know, I learned something. Did we not learn something from Eric? They thought Black History Month was, chosen because it was the shortest month in the year. We dispelled that myth. That's not the reason why Black History Month happens in February. It's because Frederick Douglass was born in February and Abraham Lincoln.
And their birthdays is right around the 14th. One's 13th, one's 15th.
That's why we have President's Day.
That's why we have President's Day. See, it all ties in. It's
one of those urban myths that got out of control.
Yeah.
So we need to ring that back in.
Yeah. We got to have a joke about it, though. I mean, it took them a while to get it to.
There might be some moral truth to the whole thing.
Right? But there's always a little bit of truth to it, right? So February is a busy month for a lot of things. So it is Valentine's month, which all centers around the heart. It is Black History Month, which we've been celebrating. We've had two wonderful guests for Black History Month. We had Eric Ewing and Mr. Preston Love last week.
Yes.
Preston gave us a lot of good information. I hope that you guys all enjoyed his interview. He is just a wealth of history and information all by himself.
Yes, he is. He's iconic on the whole figure, I would say.
Right. And so to wrap up February, we are going to talk about, it's also Heart Health Month.
Another thing I didn't know about Heart Health Month.
Right. So it all ties into Valentine heart health. So it all ties in. They appropriately put it in the right month, right?
Well, Tisa, always is on time with her topics. She said, Grant, we got to do this before we get out of February because it is Heart Health Month. We want to dedicate this particular show to that very fact, because there are some facts, and we're going to talk about this around heart health that some people don't know you need to take into consideration. So Tisa, start us off with that.
So heart disease is the number one killer in the United States.
Number one,
not whatever you thought it might be. Heart health, people having heart attacks and dying from heart disease is the number one killer in the United States. So that's number one. So more than cancer, which I would think is something, more than diabetes, hypertension, some of the things that our community are, dealing with, but heart health. And so when you talk about heart health, nearly every adult in the United States, also like half of us have some kind of cardiac or some kind of cardiovascular disease. The veins or something that's just connected to your heart is bad. So it's important. So we need to talk about heart health. What are some other statistics for Black people in terms of heart health?
We have some statistics that I think are super important that we all need to think about as we go through this. Number one, and I think you said it, but I'll say it again. About 1 in 3 Black adults have a coronary heart disease.
No, issue. That's specifically talking about Black people. No, Black people, 1 in 3, right? So about half of the population, but 1 in 3 of us. So me or you and somebody else could have it. One of us is going to have a heart disease, and that's a pretty big statistic.
I think it floored me.
Yeah,
to be honest, I didn't know it was that high, and this is something that we're dealing with, and it's something we really, really needed to take to heart about our health. And then we're going to think about this statistic. Nearly half of Black adults have high blood pressure.
Half, Eddie. No.
I need half.
Half. So half of us. So high blood pressure, you guys know, is really, really big in the African-American community. And I believe that because I think both my parents had high blood pressure. Did your parents have high blood pressure? No. Do you have high blood pressure?
No, I do not.
And I do not. So Lisa didn't have this room. but as I hear people talk and get older, and I hate to throw up conspiracy theories, but it is such a thing about Black people getting high blood pressure as they get older. Almost like you said, half the people is on some blood pressure medicine and have been diagnosed with high blood pressure.
Right.
Now, my sister even told me this last year, and I was like, what? And then, first thing she said to me was, Mom and Daddy both had high blood pressure. And I was like, yes, they did. But do you think, oh man, is some of this by design?
I'm not going to say, I believe, and we'll get into this, a lot of this is diet related.
True.
The things that you're putting in your body, and some of it is cultural, it's hereditary, some of it's hereditary. but we're not helping the situation with some of the things that we're putting into our body.
Absolutely.
We can control that.
Absolutely.
Right? We can control that.
Absolutely. Yeah. And just always keep in the back of my mind, I guess is what it is. It's like there's no cure in the wellness of keeping you well, but there's a lot of money in medicine. Right. So when I see people getting put on, and the thing about blood pressure medicine, let's talk about blood pressure medicine.
Okay.
They have blood pressure medicine now. So when you get diagnosed with blood, this is the catch-22 of it. You get diagnosed with high blood pressure. They put you on a medicine.
Yeah.
And they say, now, if you don't take this medicine, you can have a heart attack and stroke.
It happens all the time.
We're trying to, so my mind is going, we're trying to prevent high blood pressure
in the first place.
So, and then they're going to put you on a medicine that you have to take.
Yeah.
Otherwise, you're going to do the same thing which high blood pressure is going to do, give you a heart attack or a stroke. So it's a catch-22 for me. To me, that just speaks to getting you hooked yet on another medication that's going to cost you money throughout your entire life because you can't get off of it, right? If you can't get off the medicine from the time you get diagnosed at 40, 50, 60 to the time you die, they got a medicine that you're going to have to buy.
Well, it's not curing it, right? They're getting you, they're
well, what
managing.
Are they doing?
They're managing.
I think they're hooking you on that drug.
Probably.
Why don't we take the chances on just getting a heart attack or stroke with the high blood pressure instead of getting a drug we have to get hooked onto not to give the same results?
You got to practice something preventative and
that's
try to get to it beforehand. Because there's some other things that you've talked about in the high pressure world.
Yeah.
That and there's symptoms along with this, right? But I like preventive. What can we do to prevent this situation in the first place?
Right. How do you protect your heart?
We know diet, or we know about diet a little bit. We'll talk about that. But exercise. And I know in the wintertime, this is my first one in Nebraska in a long time, and I can see how you can just go from the house to the car to the office, back to the car, back to the house. And you haven't really done a lot when it comes to exercise, but there's ways of getting the things because walking is going to help you.
Yes,
right? Or anything like that to get the blood circulating, to get your body moving, right? I think that's very, very important. And that we do know about diet when it comes to sodium, when it comes to hydration, when it comes to getting the right sleep, and then understanding those generational habits. I want you to help us get these key takeaways, things that we really need to think about as we go forward.
So I would say first, how do we protect our heart? That's the main question. How do you protect your heart? We got to work from a preventative standpoint. So what are those things to do to protect our heart? First things first.
Our heart.
Protect your heart. Know your numbers.
Know your numbers.
When we talk about numbers, anytime you go and get an examination or a screening, it's always some numbers you get, right? So you get numbers for your blood pressure to make sure if your blood pressure is too high or too low. You get numbers for your cholesterol to see if your ADL and your LDLs are all in balance. And you also get glucose numbers. So all these are knowing your numbers. So first thing first, you got to get screened to know your numbers, right?
What?
So get screened so you can, first of all, know your numbers in all three of those areas because they all work in conjunction with your heart to make sure that your heart is properly functioning. So know your numbers. Number one, know your numbers. High blood pressure is often, a symptom of other things. So just, know your symptoms to high blood pressure. Sometimes it's just headaches. I don't have high blood pressure, but I know my parents were both on. It was headaches, fatigue, sometimes
lightheadedness,
and just, angry. You can fly off the handle. And, my father was 0 to 100. He was quiet 90% of the time. That 10%, it would go boom. And that's why the look. We were talking about the look.
The look.
That's why the look. When he hit the look, we already knew he was on 10. Don't do it. Don't do it. I put that out there on Facebook. I said, who all knows about the look? And people were looking at me. Some people were like, I have no idea. Well, that means you didn't have a father or a mother in your house that would knock you across the room with a quickness. And the only thing they had to do was give you a look.
And the look was real.
Did you have a look in your family?
What? No, I had a brother, right? So me and my brother and my mom, for a period of time, it was just us three. Right. Mom didn't play. No. You got to look, but the next thing coming.
It's going to be a hand.
It was not to be tested.
Yes, and we came from generations where it was spare the rod type of stuff. It wasn't nothing to get a hand across the face a lip, soap in the mouth. I was a talker. I was a talker. And about 13, 14 years old, we were past the whooping stage, but she went past the grabbing your mouth and filling it up with soap stage. Right. So I'm thinking about 15, 16, I was a talker, mouther, I was mouthy. And my mother grabbed my face so quick that Joy was the soap of the day. She filled my mouth up literally from the back of my mouth to front. Now that would be abusive today. Yeah. But it was wash your mouth out with soap mentality. You learned that lesson. You learned that lesson. Right. You did not test mom again. But let's talk about managing stress. Yeah. Intensely. Because you don't realize your parents could have been stressed and it was just that one little thing that happened. But we know that stress is a big cause. Big deal. Of heart disease. Yeah, that's when we talk about mindfulness, learning how to de-stress, meditate, breathe. Breathing is the quickest mechanism that you have at your disposal at any time to be able to regulate immediately. So, I find myself doing it now with my son. He says that and I'll be like, and I just have to do that. It really takes you down instantly. It clears up some stuff and it keeps you from reacting. Maybe sometimes violently, like I want to do with him, but it helps you. So breathing and learning those techniques that can help you de-stress immediately are key. I think that all of that is very, very important. You hear about it, you make them a pressure go up. Yeah, you hear about these. Oh man, I say that to him all the time. But it's real. It's not a fictitious thing. That your heart pressure goes up. It puts stress. It is on the most important muscle in your body is your heart. Your heart is a muscle. It's a muscle. Right. So if you don't appreciate it and work with it appropriately, it can have some issues. Absolutely. And we said the number one cause of death right now in the United States is heart disease. That's major. That is so major. So let's take a look at some things that we could possibly do, right, to stop some of this and work with us in a way that's going to be very, very helpful. So we're going to show a short clip on heart health and what that can really look like for. Well, are we going to do a CPR clip or are we just going to give some statistics? Let's do a CPR clip. Okay, so before that, let's make sure number one thing takeaway from this segment is learn CPR. Stop in at your churches, stop in at your nonprofits, find anywhere that they're giving free CPR tests because a heart attack can happen anywhere. Yeah, we want people to be aware and be prepared for a heart attack. That's so right. With that, we'll tell you a quick video on CPR. CPR has changed. It's not as evasive, putting your mouth on mouth anymore. It's just basically pumping. So show them what it looks like. And then we'll hear that story that you'll share. And easy to learn. Take a look at this. You bet.
If you see a teen or adult suddenly collapse, it is important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to ask someone to call 911. And to get an AED, or call 911 yourself and put your phone on speaker mode so the operator can assist you. Then get directly over the victim. Put the heel of one hand in the center of the chest and put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Staying Alive, or the rate of music you're listening to right now. Let's hope you never have to use hands-only CPR. But know that CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. Again, if you see a teen or adult suddenly collapse, don't be afraid to start hands-only CPR. Remember, call 911 and ask someone to get an AED. Then push hard and fast in the center of the chest until the AED and help arrives. Your actions can help save a life.
Wow, that was a great video.
It's very informative.
CPR has gone very simplified. You remember back in the day we used to have the hold your nose, tilt your, put the mouth to mouth. Yep. They've gotten rid of the mouth to mouth. So there's no reason why everybody should learn CPR right now. Because really that was some things that kind of kept people from I'm not doing.
There's a lot of jokes about it, a lot of movies about it. Like, hey, am I going to give you mouth to mouth? But now you're telling me it's really not necessary.
It's not necessary anymore.
You want to get air down into the chest cavity.
Yeah, it's just pumping air. So Some places where you can get CPR training is the American Red Cross.
Okay.
So look for your local Red Cross. Nebraska Medicine Community has community CPR classes. So Nebraska Med right here in Omaha. CHI has CPR classes and first aid training. So look it up there, or in your local fire department. They'll actually give you free CPR training, and they'll change out your fire detectors and all that for free too. So utilize your neighborhood.
One thing to ask you, because I don't think a lot of you see it all the time, whether you're in an airport, you be in a restaurant, an AED.
Yeah.
What exactly is that?
It's a heart. It's like getting your heart shocked. So it's specifically when people are having heart attacks and there's no pumping of the heart. You can put those on them, and it kind of gives you that
shock.
Yeah, shock, and it does save lives. So the schools have got them in there now.
Yeah.
It's very easy to use. They tell you on a little chart exactly where to put the patches, and it walks you through. It'll say, put the patches on body, stand back, charging, shooting. And so it's very, very clear, very step by step. So don't be afraid if you see somebody having a heart attack if you have an AED in the area. Schools have them. A lot of public places are having them now. So it's a very helpful tool. That I forget the football player that had the heart attack. He's making sure. He's making sure all the schools get it. And just like CPR, you want to have that stuff handy. But if you don't, learn CPR. It's the best thing you can do for yourself and anybody you might ever be around.
Now, you have a story that you actually had to go into action and apply this kind of technique. Tell us about that.
So I have always learned CPR. So I've always been in health. So I've learned it as a kid, probably as a Girl Scout or something. I learned it as an adult, and so when I worked for Child Protective Services, we had to learn it. So some of my jobs made sure that we learned it. But at this point in time, I was security for Lionsgate Security Solutions. Those are my homeboys. Shout out to Lionsgate, Calvin Jones, and Joe Hodges. Right. Anyway, I learned CPR through them. I was at a place before I got hired on with OPS as security. I worked for Lionsgate. We secured a lot of the schools. And so I learned CPR through them, and they still have a training for first aid, CPR, and first responders. So if you ever want to learn this professionally, and they make good money, by the way. Trained professionals. But anyway, I learned CPR through them, and I actually had an opportunity to put it all in action. So a kid walked out to the portables. I don't know if you guys know what portables are, but if you have some portables, and there's extra classrooms that have in these trailers, basically.
Right. Yeah.
Trailers. So a kid was going out to the portable. I was stationed right at the door, kind of to our parking lot, going out to came back in, and two kids came back in maybe 10 minutes after class started. A girl was like, a little boy was like doing this, and the little girl was walking him to the nurse. Well, at Beveridge Middle School, from the back door, the nurses is all the way up the hall, down the hall, and around the corner. He wouldn't have never made it, put it that way. And I was like, so what's going on? He's like, I can't breathe. He's like doing this, whatever. And I'm like, so she's like, I'm taking him to the nurse. And I'm like, okay, well, if he's choking, he ain't gonna make it to the. So I just turned the kid around and did the 100. Let me show you the 100. Stand up, Grant. So very quickly, you have to get behind them, get under their thing, and upchuck whatever was in their mouth. So he spit out a mint, one of those big round mints, onto the floor, got some air, and I saved his life.
Oh, beautiful.
They even had it on camera at Beveridge Middle School. And I got a little award, Lionsgate kind of gave me some flowers, and because that's a big deal. So when people say, like, what is your proudest moment? It's really when I saved that kid's life. Literally saved that kid's life.
Well, we got some key takeaways right now. We want to make sure you just learn this. First, learn CPR.
Learn CPR.
Somebody
it saves lives.
It saves lives, right?
Yes.
The training is accessible. You go to any
all those places,
facility, fire department, the police department. Learn CPR.
Because
you never know when that moment happens.
It's so easy. You might save your kid's life, anything, your parents' life, whatever.
And now every nurse has to do this every year to get recertified.
I think so. Yeah.
I think any public safety official, they have to get recertified to be able to apply CPR. I would figure if you work in a restaurant, there's probably someone there all the time that's trained in CPR.
Well, but you never know. So you be that trained person. It's accessible. Make sure that someone in your household knows CPR.
That's right.
So that's all I can say about that. Learn CPR. It's free most of the time, so take advantage of it. So we're gonna do a little call to action. So we're gonna make sure that you guys know that your heart health is important.
Yes.
Emotional health. Your emotional health actually contributes to your heart health.
Yep.
Right.
Yep.
So chronic stress and raises your blood pressure. Right. So that can lead to a heart attack.
Let's get, that stat. Let's go back to that original stat. You talk about the biggest killer out here is heart disease. And 1 in 3 Black people have some kind of heart condition. I think it's very, very important. And understand these toxic environments that you may be in. You're having a lot of stress in that particular situation that you may be fused in. It's going to impact your longevity.
It does. And like I said, one of my things was to stop arguing with my son so much, because really I go 0 to 10. I'm at it. And he was fortunate to witness one of our episodes. But I do. And really you only can control yourself.
Sure.
You can't control what he's saying, although I just want to, I have to learn to really de-stress, breathe through that process, and just not let it get to me to 10, because I could stroke out at any one of those episodes that I'm having with my son. And so, remove yourself from those toxic situations, because they definitely impact your longevity and how your heart helps.
And it's part of the relationships, right?
Yeah.
And if you prevent it, when you're in crisis, it's hard because you're there, you're already in it.
Yeah.
But if you know ahead of time, or that you have a certain behavior that pushes someone else's buttons, you're like, okay, I know I can feel this happening. Let me do my preventive work so it doesn't have to escalate to that higher level, because it is going to impact your health situation.
Absolutely.
Right.
Absolutely.
One thing I learned just talking to you today, things that impact your heart is they measure certain things, like they measure glucose and cholesterol. And
so what? Number one, you got to do what? Know your numbers.
You got to know your numbers.
First thing in dealing with your heart, you got to know where you are right now in terms of. Hello. Well, we're back for our last segment.
That's right.
So we're going to talk about emotions and relationships as it regards to your heart, right? And so we know that chronic stress and relates to high blood pressure, relates to bad heart outcomes, right? Same thing with toxic relationships and toxic situations. Right. All of these increase your blood levels and increase your blood pressure to the point where it can affect your heart negatively.
Exactly.
So the opposite of that is having healthy relationships to reduce your stress, right? Get involved with people who bring you joy, who doesn't bring you stress, you ain't arguing with all the time, that you're having fun with. Surround yourself with people that de-stress you. And community connection. Community connection is real important to your heart and to your heart. And in terms of your heart as a spirit being needs community connection. Right. So stay connected, because I tell you, when you isolate and when you're by yourself, the heart rate drops, your serotonin drops, everything drops into the point where even depression can affect your heart negatively. So you want to be connected and community connected. It all improves your heart health.
All these are really good takeaways that we're talking about. I like the word community is medicine.
Yeah.
And if your community is not medicine, is actually causing you a problem, you got to look at that, right?
Who you're surrounded in your community.
Who you're surrounded in your network. We said in the past that your network is your net worth.
Yeah.
Right. So your community, the people that you are around and you're interacting with all the time, that should be your medicine. That should be a de-stress situation, not a stressful situation.
Yeah, because healthy relationships protect your heart.
Protect your heart.
And emotional health affects your physical health, right?
Yep.
We know if you're stressed all the time or whatever, you're not going to operate optimally. You're not going to be, being your best self. So, take care of yourself emotionally, mentally, physically.
Yes, I agree with all of those things. And then as we segment just a little bit about health and wealth, right? We didn't really touch on wealth at this point, but there are historical barriers around this. What do you think about when it comes to healthcare access?
Yeah. In some of our communities, it's still hard to access good healthcare. But I guess I want to start with the man in the mirror. First of all, making sure that you find out who it is in your community. And if it's not, make sure that people are providing that in your community. We can't just say we don't have it, so I'm not going. You got to find out where those accessible points are, where those clinics are, and go. We can say we know that it's around the corner, but if you never step foot in the building, it's not going to help you.
Yeah, that goes back to knowing your numbers, as you said before. Where are you at? What's your current state of healthcare? And don't let finance be a barrier, because now, even though there's been some increases or decreases in healthcare and the price of healthcare, Obamacare has now used to be a certain rate. Now it's triple. People are like, oh, I'm not going to pay anything. So now you don't have healthcare. However, There's still some community programs that if you just let them know what your situation is, you can get access to healthcare that can help you. And I know I see a lot around town around what Charles Drew is doing as he clinics around.
Yeah.
I want to see lines over
Yeah,
there.
they're access. They have Charles Drews and clinics right next to the Girls Inc. and right next to these schools that are right involved. So the access is there. We're going to make sure we take advantage of those access, but also just really work from a preventative standpoint, right? Get out there and do those preventative things that'll, being surrounded by positive people and watching your heart health in terms of the toxicity that you involve in, that you have around you. Prevention is investment. You know what I'm saying? That if you it's investments. When we talk about wealth, health is your wealth. So we have to invest in our health,
wealth,
and relationships.
We got to do it. We have to invest in it. And I'll go back to something I learned. I learned this today talking to Tisa, because I know diet has it's big. It's the
thing. It's the thing.
When we talk about cholesterol, and she said, "What do you know about cholesterol?" I said, "Butter." Butter's in your blood.
Well, because those things we just know getting to, right? People are like knowing your cholesterol and learning your glucose, your glucose levels,
and what is that glucose
your BMI. These are terms that people are. I would say in the last 5 years are just getting to even know what it was. So I asked
you don't gotta look it up.
I said,
glucose,
what's cholesterol?
Well, cholesterol is butter.
He said the butter in your butter in your blood.
Hey, butter in your blood is clogging it up. There's butter in your blood. And glucose is sugar.
It's sugar in your blood. It is sugar. That leads to diabetes.
It's just too much sugar. So you're causing your heart. So when you get a constriction, what happens? Your pressure goes up, right? Right, because it doesn't have a clean flow. Right. So you're causing, the constriction of your arteries, and that is putting pressure on your heart. Constriction.
Yeah.
I
was like, it is under construction. But we don't want it to constrict your arteries, butter or sugar. Right. And so, so what we need to start doing, just like we always try to get people to thinking of a preventive state of mind, as you think about just life in general, we want to start leaving a legacy of good health. We have so much legacy of bad health, right? Our parents have left us a legacy of bad health. And because they had to do it out of necessity and need, we don't have to do things out of necessity and need. We do have to do it out of necessity for good health. So let's flip that into, now we're leaving our generation leave a legacy of good health, right? Preventative mindsets, being examples of good health, being examples of a person who eats well, instead of just do those bad things on Thanksgiving, New Year's, Christmas. Not all the time, right? Our parents had to do it. We don't have to do it. So leaving a legacy of good health, making sure that our kids get physical activity, get them off those screens. You have to control that. Parents, you have to control
Get them outside.
Get them outside. Take the screens, take the tablets, take the phones. If you have to monitor that.
You can do push-ups indoors, right? You don't have to be like, hey, it's too cold outside.
Take the device. All I say, start with taking the device and let's go for a walk. Let's go for a walk and talk. I do my walks on Instagram. I call them Tisa's Walk Talks or whatever. I just get on and talk to people about whatever is on my mind at the time. But it's usually health related. It's usually talking about upcoming events. But start some type of a legacy of good health, whether it be I walk with grandma all the time, or I go over this grandma because she eats healthy. She makes sure that we're putting together healthy recipes. So start good legacies of good health.
All of these things are what we can do for preventive. I'm always going to say to my monitoring, you can get these Fitbits now. Even on your phone, you can start to monitor your health. What happens the first time you turn on your car? It starts to tell you the health of the vehicle. How much oil is there, if it's cold or hot, how much gas you have. What are you doing around yourself? When you wake up in the morning, what are you monitoring? What is it telling you?
How you feeling when you wake up?
How you feeling? What is your heart rate today? Right? Right?
Especially if you have those things in your family, hypertension, and or you have been to a health fair. Go to those health fairs. We talk about access. Go to those health fairs where you get free health screening. We have them in October. I did want to let everybody know that the Black Family Health and Wellness is going to be coming up here on March 28th, North High School. take advantage of the free screening, and then follow up on your screening. Make sure that if you find something out that you didn't know, or if you need to take care of something, like your blood pressure is high, or like your glucose is high, or like if your cholesterol is high, make sure that you follow up and ask them what can you do to reduce those things between now and the time you can hopefully get in to see a physician. If you need to see a physician, please check with Charles Drew. Yes. They should be at that Help Black Family Health and Wellness. They are setting people up with primary care physicians, and that's real important to have for a good consistency of care, to have one person in charge of all of your care. So see, if you don't, plug for Charles Drew right now, have a primary care physician, please see them at their table at the Family Wellness, or just stop in and tell them you need a primary care physician. We need to start there with the continuity of care.
Let's start impacting these statistics. We need them to be going in the right direction.
Absolutely.
Not the wrong direction. So we've got to be preventive and look at those things. I want everyone to understand when we say health, wealth, and relationship, these are all connected. They're one circle. You got to monitor your health. You got to monitor your wealth, monitor your relationships, understand where you're getting from a stressed relationship, things that we get hyper about, right? And understand what those are interconnected, the diet, the exercise, all that. If you start doing those things, it shows me that you care about yourself, and you can really do something to be impactful as you start. And hopefully we're going into the March time frame, which will be springtime.
Springtime. Oh, I'm a spring baby. I'm so ready for some weather. But, we can't complain because we got our first snow, February? What is last week?
I think it was November. But we had a snow in
just now. We just got February, our snow. But we hadn't had snow since Thanksgiving, which was November. So that's 6 months worth. Pretty much we have had no snow. So, it's still some on the ground. We'll deal with it. And we might even get another one because it's still just the end of February.
Well, we're getting there.
Yeah, we're getting there. I can see it. I can see it coming. So, takeaways for the show. Let's talk about it just real quick. Prevention is an investment. Yes. So again, think about preventive modes, thinking about being proactive, thinking about your health before something happens to it. That is an investment in yourself and an investment.
And sign up for CPR training. Sign up. Everyone in your family, whoever your family unit, somebody needs to know how to do CPR. CPR. Again,
okay, so we're going to wrap up this segment of health, wealth, and relationships with Tisa and Grant. So we were talking about heart health. So our key takeaways today are to, number one, know your numbers.
Know your numbers.
All right. Number two, schedule a heart screening.
Absolutely.
So you know where you're at. So you've got any clogged arteries. Move daily.
Move
daily. And manage your stress intentionally. Guard your heart. Make sure you're around positive people. Don't be around chaotic people. Yep. So just be real intentional about how you move.
Yep. And sign up for CPR training.
Sign up for CPR training.
Save somebody's life.
Yep. Save somebody's life. Well, I think that's it.
For health, wealth,
and relationship with Tisa
and Grant.
We'll see you next time.
Tune in again next week. We're doing this every single week. Make sure that you comment on everything that you see. We want to get your feedback, and then we might even feature you on a future show.
Peace.
Imagine waking up with more energy, a peaceful mind, and relationships that grow stronger every day. That is the vision Tisa Harden and Grant McGaw want to help you achieve, and it all starts with simple, practical steps you can take this week. On Health, Wealth, and Relationships, every episode brings you real stories and trusted experts. Tisa and Grant focus on 3 tactical steps each week. Small, doable moves that protect your health, grow your savings, and bring you closer to the people you love. No complicated rules, just real progress. Try a clinic-to-kitchen swap to boost your energy. Start a money buffer habit that quietly builds your financial confidence. Or try a 1-minute exercise that helps you reconnect with your partner. These quick wins are not chores. They are steps toward a better life. People who try just one intentional step report more energy, less money stress, and evenings full of laughter again. Join Tisa and Grant. Start small, live bigger. Tune in every Thursday at 10 a.m. on Facebook, LinkedIn, and YouTube, and subscribe now.